Everyone, it's Jasmine, and in today's video we are discussing medication management and how to safely and effectively take medications. So I hope you learned something and take something away from today's video, and let's get started. So what is medication management? Medication management is a process to ensure that medications are used and taken appropriately. Medication management focuses on taking the right drug, the right dose, through the right route, at the right time, and for the right patient. In addition, medication management includes monitoring for effectiveness of the medications and any side effects. So why does good medication management matter? Adequate medication management is important as it reduces medication errors and any adverse reactions that may come from those errors. It improves patient health outcomes when individuals are taking their medications properly. It encourages safe self-management at home and independence. And it supports healthcare system efficiency if the medications are taken properly and treating the symptoms they are intended to treat. Now, the importance of safe and organized medication management comes from the challenges that can commonly be faced with having to take medications. These challenges include, but are not limited to, forgetting doses or taking extra doses by mistake, having difficulty managing multiple prescriptions at once, stopping medications due to side effects or cost without a physician's instructions. A lack of understanding or unclear instructions can lead to poor medication management, and poor communication between different healthcare providers can result in the patient potentially facing difficulty with managing their medications and understanding what medications they are meant to be taking and when. So to mitigate these challenges, there's a role of the healthcare providers. And this role is to prescribe the medications based on safety and evidence, so making sure they are prescribed in safe doses, at a safe frequency throughout the day or the week, etc. It also involves reviewing and updating medication lists at every visit. And what this allows is to ensure that patients are taking medications that they actually need and aren't still taking medications that they no longer need. This also includes providing education on how and when to take medications, and this should be coupled with the review and updating the medication lists at every patient visit. It's also the role of healthcare providers to watch for drug interactions, allergies, or duplications in a patient's medical history or in the symptoms that patient may be presenting with. In turn, the role of the healthcare providers is to support patients in overcoming barriers to increase their adherence to taking their medications. Now, the patients who the medications are for also have a role in supporting good and effective medication management. The role of the patient includes to follow instructions carefully and consistently, to maintain a current medication list and share it with providers, to report side effects, missed doses, or concerns quickly, to ask questions and to seek clarification when they're unsure about maybe the reason they're taking a medication, the dose and frequency they should be taking it at, etc. And they have a role to ensure they are storing and handling the medications they have been prescribed responsibly at home to protect themselves and to protect others in the home. Now, there are many tools that are available to help support safe medication management. These tools can include pill boxes, blister packs, and pharmacy-prepared dose sets. Also, it's good to know that if you have been prescribed a certain medication and it's come in a pill bottle, what you actually can do if you would like to have your medications organized in a blister pack is you can often take the bottles of pills to your pharmacy with the prescriptions and ask them to prepare a blister pack for you. And this allows the scheduling of your medications to be very clear and easy to follow. Also, using reminder apps or phone alarms, or even having a caregiver, friend, or family member check in every so often to ensure you've taken the medication can be super helpful in making sure you're taking your medications on time and not missing any doses. Using again the medication review services at the pharmacy. So, when you're prescribed a medication, if you have any questions, you know that you can ask the pharmacist and have them review everything with you. Writing out your own schedule or charts for your medications, if it's something that you can follow a bit easily, then that can be useful in making sure you're safely taking your medications. And then making sure the medication bottles have clear labels in large print. And if these, say, pill bottles, the label has faded or if has come off for any reason, you can take that medication back into the pharmacy and have the pharmacist review all of your prescriptions to figure out which one's missing and how to replace if appropriate. Now, safe storage and disposal of medications is very important for effective medication management. This involves keeping medicines in their original packaging to avoid mix-ups, storing medication in a cool, dry place away from children and pets if they are around the home. It's also important to make note if you have been told that a medication should be refrigerated, that those are kept in the fridge, again, out of reach of children if appropriate. It's very, very essential that you're never sharing prescriptions with others, even if they're in your family. If any of your medications have expired or they are not in use, a medication has been discontinued, let's say, by your doctor, then what you want to do is, instead of tossing the medications in the garbage can or flushing them down the toilet, make sure you're packaging in them, even in just the pill bottle or a Ziploc bag, and bringing them back to the pharmacy for proper disposal. Now, there's special considerations that we have to keep in mind when it comes to taking medications and managing medications. For the older adult population, it's common for individuals to be on multiple medications. With this, they are at higher risk of falls and at higher risk of medication interactions. So it's very important to monitor closely for side effects, whether that be drowsiness, dizziness, lightheadedness, chest pain, and so on, and to report them immediately. Now, for children, medications are often prescribed based on their weight. So the dose is calculated using their weight, and with this, it's important that the medications, when they're being taken, is strictly supervised. This may entail that medications need to be cut in half if their weight requires half the dose of the pill, and so on. And it's for this reason that strict supervision is recommended and required. Now, chronic illnesses and individuals with chronic illness often require long-term use of medication. With long-term use of medication, it's extremely important that they are properly adhering to the prescription that they have been prescribed. The reason for this is if they have been taking a medication for years, if they start missing doses, their body doesn't know essentially how to react without the medication, and it can result in adverse reactions or side effects. It's for this reason that medication management is extremely important, and it can be very useful to set reminders, alarms, use blister packs, and so on to make sure medications are being taken properly. And finally, we have to consider cultural and language differences. So, if a patient is provided medication instructions in a language that is not their primary language, we have to ensure the information that they need to know has been made clear to them and accessible to them. We also want to make sure we're, of course, always being respectful and making sure that everyone is on the same page when it comes to managing and taking medications. Overall, medication management improves safety, treatment outcomes, and quality of life. The success depends on teamwork between patients, providers, and pharmacists, supported by tools that can encourage adherence, such as reminders, alarms, blister packs, dosettes, and so on. Safe storage, proper disposal, and clear education are also key to protecting individuals and communities. Thank you for watching.